Hello, everybody. Welcome to Chamber Chat. I am your host and chairman for the Greater Toms River Chamber of Commerce, Adam Stravodio. And today with me, I have an amazing guest, the CEO of Community Medical Center, Pat Ahearn. Pat, thank you so much for having me here and spending this time with me today.
My pleasure, Adam. I'm very happy to be with you guys.
So I've heard there's a lot going on at Community Medical Center nowadays. So can you fill me in on some of the things that are happening here?
Well, it's interesting. I've been here 6 years as the CEO at Community, and I came here with a vision. I was very disappointed. I thought that Community could always be more than it was. So, when I decided to take the job and when it was offered to me, I thought it was a great opportunity to come to a place that I thought was really underserved. And so I came down here 6 years ago. And it's been a lot of fun ever since. We created a master facility plan to be able to rebuild this place. But more importantly, when I came down here, it was, what is this community like? And it's a little bit different. As you know, Adam, I came from up north. I was at St. Barnabas for 16 years. And it's a much different community being in northern New Jersey than down here. The interesting part of this is there's 600,000 plus people down here. And I don't think people really realize that. When you talk about 600,000 people, cities like Boston are 600,000, Detroit are 600,000. Wow. So, it's, you wouldn't think twice about having major medical centers in cities like that. In fact, you have multiple major medical centers. Our issue is we don't have a real city, it's spread out. So, but when you think of that, you say, wow, 600,000 people. The other interesting part is high Medicare population. So 65 yes. And over, I'm one, thank you very much. But 65 and over, and it's different needs than, again, up north. And the other piece of it, which is I found fascinating, didn't know this, highest super senior population in the country. Wow. Here. Super seniors 85 and over, right? And that's here. It's not Florida, it's not Arizona, it's Toms River, New Jersey. So again, when you look at the population, then it becomes, I'm not that smart, right? You turn around and you say, okay, what do people need? Right? What do older people need? And and what should you really be good at? No mystery. The most strokes in New Jersey, Ocean County. You need to be great in neuroscience. Yep. The most cardiac surgeries in the state of New Jersey, Ocean County. Interestingly enough, we don't do cardiac surgery here. So all the cardiac surgeries, and you're talking about older people having cardiac surgery, have to go someplace else to get their cardiac surgery. Orthopedics, I can attest to that, as I try and do silly things on weekends that really don't turn out well. And oncology, right? A huge oncology business. So when you look at that, then you start taking stock and say, all right, I'm not doing this for myself. I'm doing this for what do the people in this community need? And I take that very seriously. And so when you think of what the people need, okay, if that's the menu of things, where do we stand? How do we build those programs? Because the other interesting part of Ocean County and the population here is they hate to travel. There's no allure to New York or Philly. In fact, about 6 months ago, I got data about out-migration. Every year there's a report that comes out that talks about how many people leave New Jersey to go to New York or Philly for their health care. About 20,000 people left last year to go to New York, wow. And about 16,000 people left to go to Philly. Interestingly enough, for New York, almost nobody from Ocean County went to New York. It was all Bergen, Essex, and the people up north that went in, for knee replacements, whatever, into Manhattan. And most of the people that went to Philly were from down south. Very few people from Ocean County actually leave Ocean County. So again, when you look at that, you say, all right, if people are not willing to travel, and what I found also is since they're not willing to travel, even if you gave an appointment, they're not willing to travel, then it becomes, how do we bring the services here? Because they actually avoid healthcare. So if you're not willing to travel, then you turn around and you say, okay, well, I'll only do it if I have to do it.
Yeah.
And so then people, again, I found here, really put healthcare off. And then when we get them, they're much sicker than they really
It's too
could
late.
be if
Yeah.
you actually intervene. So there's a lot of dynamics that go on in this community that I came here and said, all right, well, you can either ignore it or you can embrace it. I choose to embrace it. And so I said 95 to 98% of what our community needs, we should deliver here. And so when you start down that road, you say, how much do we deliver here? Well, okay, we got a ways to go.
Yeah.
And so over the past 6 years, what we've been doing is building the programs and bringing the people in to deliver that 98% of the services that our folks need here. So I think it's, it's been a lot of fun. It's been stressful. It's been trying to bring people into this community. But I think we, unfortunately, probably benefited from the pandemic in that a lot of people that were working in New York and Philly and other places have done with the city. A lot of people moving down the shore, and a lot of people were living in New Jersey and then commuting to other places. We have hired some of the most talented, spectacular physicians in all of those services that I talked about. And it's not just physicians, staff, and everything else. So long-winded answer to your question, but I think you have to set the background to understand what we're about, what we're trying to do here. And I'll leave you with one last thought. The other thing is, I talked about big cities, having medical centers, academic centers, all the rest of this stuff. Okay, if we're not that, a high-end, what I call a high-end tertiary hospital, if we're not that, then there's not anybody in Ocean County. You have to go an hour each way to get high-end services. So you're talking about 2 hours between different places. And that's where I looked at it, and I have an obligation. I'm like, that's not right for our community. We need to be that high-end tertiary academic medical center. And that's what we've been striving to do, and that's what we've been building over the last 6 years. And we've made a lot of progress and a lot of success in that. So.
Definitely, definitely, and I've experienced it myself. I've been a
Yes,
guest of your emergency room a couple times. So
unfortunately, yes, we know that, but
and it's you could definitely see the change, and you're definitely building a powerhouse of a medical center here. So thank you for everything that you're doing. Also, on my way in, I noticed a lot of construction going on. Can you give us some insider information as to what's going on here?
Yeah, it's not only do you have to bring the folks in, you have to have I'll call it the campus and the place to be able to deliver the services. And so our hospital is 60 years old, basically. It's been put together over the last 60 years. And so at the end of the day, we went to the town. And I have to tell you, the town's been great to work with. And part of it is also, I believe, again, what we should be is something that the town should be proud of. I think we should be an asset to the town, that when people move into the community, one of the things they ask for, right? How's your hospital, or how's healthcare, how's schools, right? Those are the two, it's probably in reverse, schools and then healthcare. And so I want people to be proud of us and know that we deliver great services. So this way, then when somebody moves in, they say, oh my God, the hospital here is great, right? We should be an asset to the community. And part of that is, okay, we need the facility to deliver those services. So we went to the town, I guess it's probably 4 or 5 years ago now, 4 years ago, and we put a master facility plan together. Because what I didn't want to do was, and this is anything, it's like home, it's any place else, you got renovations to do. I want to do the kitchen. Well, then you do the kitchen and the rest of the house isn't what it should be, right? And then next thing you know, you're doing the living room and the bedroom. And then you're redoing part of the kitchen because you do, oh, let's take this wall down. So I said, we did that when I first got here. We started renovating some stuff, and I said, you know what, this makes no sense. And I said, what do we want to be 10 years from now? What programs do we want to develop? How do we want to, serve our community? And so we put together a master facility plan that basically rebuilds this whole place and adds to it. Part of it is to, bring the services to the people that work here to be able to do their job. But also it's about giving the community what they need. We suffer from, again, 60 years of when this place was started and built. People probably don't even realize this. It's a problem throughout New Jersey. Probably 40 years ago or so, you were not allowed to have private rooms in the hospitals. Hospitals, when you went to the state to get approval to build a hospital, you were only allowed to have 10% of your beds private.
Wow.
So all older hospitals like ours, and when you say 10% of your beds, so if you're a 400-bed hospital, that's 40 beds.
40 beds, yeah.
Our ICU is 30 beds. So most of the beds, they're considered private, right? You have to have a private ICU. And so people that built hospitals way back when, and there were all reasons for it then, but in today's day and age, any new hospital, amenity-wise and everything else, it's all private rooms. And so ultimately, that's what our master facility plan is, to rebuild this place, to make it 100% private rooms, because on any given day, we have probably 50 beds that are out of service because somebody has an infection. And you can't put another person in the same room with somebody with an infection.
Makes sense.
So it's very inefficient in that, yeah, we don't have private rooms, but we make our semi-private rooms private rooms, and they're too small, et cetera. So all these challenges were laid out. And so we have I'll call it a 4-phase project. The first phase is, as you came in today, we opened our parking garage.
Yeah,
It took
very
a
nice.
year to build. Opened the parking garage yesterday. And so we're excited about that. That was the first phase, $60 million. So again, we put together a plan that said, what do we want to look like 10 years from now? And we went to the state, and I mean, not the state, I'm sorry, the township, and they embraced it and gave us approval. So we have approval for the next 10 or 15 years to build out our plan without interruption, which is important because, how things change, and all of a sudden somebody will do phase 1 and phase 2, and somebody may say, we're not interested in phase 3. Well, phase 3 doesn't work. Phase 1 and 2 don't work without phase 3. So it's been entertaining, interesting, and again, we've had a lot of support and a lot of great partnerships.
That's great. That's great. And it's the parking garage looked amazing. Congratulations on
Thank
that. And I had a tour last year of the helipad that you guys put on,
Yep.
so that was neat. Now you guys are a teaching hospital, so what's
Yep.
going on with the residents? Can you give me some updates on them?
Yeah, part of that, a little, for those that don't know me, I'm a New York City kid, so a little, tongue-in-cheek periodically. I always thought it was very interesting when I got here that our website seemed to think that this was a good thing. It had the largest non-teaching hospital in the state of New Jersey. And of course, I got here and said, take that what off the website. And not that I dismissed hospitals that don't have teaching programs. Again, if you're going to be a really high-end tertiary hospital, you can't do that with just the medical staff. You need a residency program. You need that infrastructure. And I also believe, again, high-end, if you want to be a high-end place like us, it brings something to the medical staff. It raises the level, not just to the medical staff, but to the nurses and everybody else around here. You've got people, and I've got my kids, and endlessly curious, ask a million questions, and your tendency is like, go away, but at the end of the day, you can't say go away. If you want them to be great, then you get these moments where you have to tell them why and teach, and then they, because of their questions, they make you think about stuck in old ways. And so, bringing teaching was a big thing for me. I got here and I said, I wanted to bring a teaching program here. And people said, we've been trying for 60 years and we were unsuccessful. I said, well, you haven't tried very hard. All you have to do is, it takes a few years, but you fill out an application, you got to get approval, and you have to be committed. And I'm not sure the people were committed, but I was unbelievably pleased with the commitment from the medical staff and others to really raise the level of what we do here. And so we have residents. In 4 years, we've grown from basically 0 to next year, we will have 150 residents here.
Wow.
In all different specialties. We're internal medicine, surgery, podiatry, emergency room. We have a thing called transitional program. We have fellowships. I mean, it's been great. Really has raised the level of what we do at this institution. So I'm very proud of that.
That's incredible. And you're bringing some amazing people into the area because these are doctors, potential doctors that are coming from all over, not just right from Tom's River. So you're bringing a lot of that talent into the area.
Yeah, well, part of this is, the pipeline for physicians is problematic in terms of there's a lot of need. And so part of this is how do you attract physicians to Tom's River, New Jersey? Not that it's not a lovely place, but people don't know about it. And so I think part of it is you bring a lot of these residents down and they spend 3 or 4 years here, and they get a feel for the area and they fall in love. And so we were successful, and we had our first graduating class last year, and in both internal medicine and emergency room, and a whole bunch of the residents stayed and are now working here. That's exactly why we do this. That's exactly what we want.
That's
they
incredible.
Create relationships. They understand the place, and people really, like to serve this population. It definitely has a need, and
How could you not fall in love with this area? You got Seaside, the Jersey Shore right there, and of course the Greater Tom's River Chamber of Commerce building the community. So Pat, anything else you'd like to share about what's going on with the hospital?
Part of what I did when I got here as well is, again, the Queens City kid of me. I think of auto mechanics and I think of healthcare as break fix, right? People break down, they come in here, we fix them, we send them out, they break down, they come back, and it's this endless cycle. And I think we should be more than that. So part of it is we changed our mission statement, because most hospital mission statements are a page long, and who cares? You get bored after the first sentence or two. And I created mission statements that were really simple so all employees can understand it and embrace it. And, to me, our mission statement is we're here for the health of our community. Now, that statement doesn't say within the 4 walls of the hospital, and I take it very seriously. We're here for the health of the 600,000 people. And so if you think about that, then it's not just in these walls. What can we do to impact the health of folks, not just break fix and send them back out? How do we get involved in our community? And so we've done a whole bunch of things. One is we've gotten out of these 4 walls and we've set up 6 what I call hubs that, physician offices with other amenities. My whole point was you shouldn't have to drive more than 10 minutes. And if you don't need to come to the hospital and you need to get basic services, we should bring that out to the community. Get out of the institution and be out there. Second thing was, what impacts health? And quite frankly, there are a few key things. Transportation, people not being able to get to healthcare, housing, which we see often, people have struggled with housing, and food insecurity. And so we can ignore that or we can get involved. So some of the things that we've done over the past year, we actually went to one of our poorer communities and helped them develop a garden that we run. Sadie Vickers and us partnered, and we went out there and we have a community garden that we invested in. It was really terrific, and 30,000 pounds of food that we distributed to the community. And this year or so, we're talking about putting up structure out there and expanding. So again, our involvement with the community.
That's great. I love seeing that you guys aren't just a hospital, you're getting involved in everything to help in all those other facets.
90% of our employees live in our community, like within 10 miles of the hospital. I mean, so think about that. Yeah. As big as we are and as many people are around here, we are still a community hospital in terms of if we're serving somebody here, it's probably somebody's mother, brother, sister, uncle, aunt, neighbor, cousin, and so there's an obligation for us to take care of our families. So, and if we don't do a good job with somebody, then they're going to tell their mother, brother, sister, cousin, and so, we want to take care of people as if they're our family. I'm a great example of that. I can't work in a place where I won't bring my family. I mean, that to me is just not right. And so that's part of the drive. I want to run a hospital and deliver services that I bring my family to. And unfortunately, like you, Adam, my family has been down here numerous times. and for all different services.
Yeah.
But that, that's what drives me. I want to just be able to deliver great services and take care of the people in our community.
That's great. Thank you for that.
You're welcome.
I know you guys have your Red, White, and Brew coming up, and I personally plan on attending if I can get a ticket for that.
I'll get you a ticket.
Excellent, thank you.
I know somebody.
But I heard you guys are celebrating 20 years. That's incredible. Tell me a little bit about it.
Yeah, the Sitta family, who supports our oncology program, have done that for 20 years, and it's been a great relationship and partnership. And we're so grateful for the support of them and others in our community. People have really supported this institution. And so we do a thing, it's very casual, if you will, Red, White, and Brew. As you know, it's over 400 people at the Toms River Country Club. It is a fun, fabulous event. It brings, we have food, a bunch of the chefs come in, and we have, a bunch of other folks that have beers and stuff like that, and wine. And so it's a really nice event, and it's for a great cause, because it really is about, supporting our cancer program here. Sitta family's been doing it, and we thought that this year, because it's the 20th, what better time but to recognize them and celebrate them. They're very, they're very modest about it. And it took me a little twisting of the arm to be able to convince them that they deserve to be recognized, and we're grateful for them and the support they give us.
Yeah, definitely. And what's the date for that again?
It's June 4th.
And
yes, June 4th.
They can head to the website to get tickets, or reach out to the foundation.
Yep.
Excellent. Well, thank you so much, Pat. I really appreciate you taking the time to talk with us today. This has been hugely informative. It's always a pleasure getting to listen to you talk about what you guys do here, because you really do so much good, not only in the hospital, but for the community. So thank you for all of that.
My pleasure, Adam. Thank you. Thank you for actually, inviting me. I think it's important for me to get the word out as to who we are and the difference between community. I know people years ago keep thinking of us as our name, a small community hospital, or anything but that. And what I often say to the folks that I meet out and about now is, if there are things that you think that we should be doing, improve on, whatever, that's stuff that we want to hear. We're your hospital. We want you to be proud of what we do here. And so when nobody's ever perfect, but we're striving to be perfect, because we care about the people that we serve, and we want to take care of them as if they're part of our family. And so I think we're getting there, and we'll continue to improve over time.
Excellent. Well, thank you so much again.
You're welcome, my friend.
Appreciate it. Thank you all. Stay tuned for our next Chamber Chat, and subscribe to the Greater Toms River Chamber of Commerce YouTube channel. Thanks again.